Hi, everyone. As Deanna mentioned, my name is Melissa Fazari, and I'm a clinical research coordinator working with neurosurgeon Dr. Michael Cusimano at St. Michael's Hospital in Toronto. And I'm honored to be here today to talk to you about a research study we have underway on earlier diagnosis of acromegaly called BEAGLE, and to also discuss some of the effects of the disease on quality of life. So a little bit about Dr. Cusimano, who unfortunately couldn't be here today. He's presented at the Acromegaly Canada conference over the past 3 years, so he definitely sends his regrets, but I'm here on his behalf. His specialty is in endoscopic and skull-based neurosurgery, and he was actually the first to perform a fully endoscopic resection of a pituitary tumor over 31 years ago in 1993. So as I'm sure you already know, I'm not going to go into too much detail, but acromegaly is caused by a tumor in the brain leading to overproduction of growth hormone, and this wreaks havoc on both the inside and outside of the body. So here is one of Dr. Cusimano's patients who's given us permission to share his images, and his story is typical of the ones we hear in the clinic every day. He started off healthy, but early on started to have excessive sweating and sleep apnea. A few years later, he developed hypertension, and so his doctors prescribed him medication to deal with the high blood pressure. A few years later, he was diagnosed with diabetes, and again, doctors prescribed him medication. 3 years later, he developed carpal tunnel syndrome, and then in 2018, he suffered a heart attack. Thankfully, he survived. Over his time, he saw over 20 doctors, but not a single recognized acromegaly. It was not until he visited one of his college friends, who he hadn't seen in years, who noticed that his face had changed quite a bit. So then he was immediately referred to Dr. Cusimano, who confirmed acromegaly and performed surgery to remove the tumor. But this wasn't until he suffered years of devastating symptoms. So unfortunately, both the lack of awareness about acromegaly, coupled with the difficulty noticing it, contribute to an average diagnosis time of 10.5 years. So the question is, why did we have to wait for that college friend? Could we not have sniffed out the disease earlier? So, just like Dr. Cusimano's patient on the previous slide, among other patients with acromegaly, acromegaly leads to significant and devastating changes to the face, hands, and feet, and this ultimately affects quality of life. So what is meant by quality of life? Well, quality of life is a subjective measure of well-being and happiness, and it's influenced by a variety of factors, which includes one's physical, mental, and social health status. So the purpose of this figure is really just to show some examples of what is meant by physical, social, and mental health, to show how these components overlap, which makes quality of life complex and difficult to improve. So there are very few studies which have looked into the psychosocial factors associated with quality of life, particularly in acromegaly. A psychosocial factor is really any exposure that can affect physical health through psychological mechanisms such as personality, cognition, emotion, social interaction, etc. But actually one study done earlier this year, it was a scoping review which included 21 studies. What they found was there are 10 categories of psychosocial factors associated with acromegaly, associated with quality of life in acromegaly. The two most frequently reported factors are depression and anxiety, and the general conclusion among these studies is that high levels of depression and anxiety are associated with worse quality of life in acromegaly patients. Some of the other psychosocial factors that this study found associated with quality of life are psychiatric distress, body image, illness perception, acceptance of illness, stigma, medicine beliefs, and sleep quality. So since transsphenoidal surgery is kind of the first line of therapy or treatment for patients with acromegaly, Our research team wanted to kind of look at the effect of surgery on quality of life in acromegaly patients. So typically in the clinic, what Dr. Cusimano does is he gives his patients routine questionnaires. In this study, we gave our patients the short form 36 or the SF-36, as well as the PIC-QOL or the Pituitary Quality of Life Questionnaire before surgery and 3 to 6 months after surgery. And we were able to obtain this data from 52 acromegaly patients in clinic. So the purpose of this slide is just to highlight some of the differences and similarities between the two questionnaires which were given to patients in the clinic. The SF-36, as I mentioned, or the short form 36, is a generic questionnaire. It's not specific to any disease. It contains 36 questions, hence the name. It has 8 domains. 3 of those domains overlap with the Pituitary Quality of Life Questionnaire. The Pituitary Quality of Life Questionnaire was actually developed by Dr. Cusimano and the research team, and it's been validated. It is a patient-centered tool for people with pituitary tumors. It has 6 domains, 3 again, which overlap with SF-36, which are general health, emotional well-being, and health, and social functioning / family well-being. But it also has domains which are specific to patients with a pituitary tumor. So I'll go into a little bit more detail on each of these. As I mentioned, SF-36 is a generic tool. It has 8 domains, which are here, 36 questions total. This slide is really to just give you an example of the types of questions that would be asked in each domain and that the patients answered. Each domain is scored from 0 to 100, whereby higher scores indicate a more favorable health status. The Pituitary Quality of Life Questionnaire is a patient-centered tool for patients with a pituitary tumor. It has 6 domains, as I talked about. It has 54 questions total. This questionnaire was developed through an iterative approach, meaning the choice of questions that are included on this questionnaire were not only informed by a literature review, but they were also informed by focus group interviews with both patients and healthcare professionals. So it has 54 questions total, and each question is scored from 1 to 7, poor to excellent, whereby higher scores, again, would indicate better quality of life. So the 3 domains which are specific to pituitary patients are the health problems related to the pituitary tumor. We also asked about their relationship with the 3 main doctors that help manage pituitary tumors, so neurosurgeons, endocrinologists, and family physicians. And also we asked patients to rate their treatment and its side effects and how that affects their quality of life. I just want to also mention that this is the questionnaire that we're going to be using in our BEAGLE study, which I'll touch a little bit more on later. So the PIC-QOL. So we have data from our 52 acromegaly patients before and after surgery who completed both questionnaires. If we look at SF-36 first, this figure is really just showing, it's plotting the mean or average scores across each domain. And the little capital H looking things are error bars. I'm not going to go too much into statistics for the purposes of this presentation, but it just measures the amount of variability among responses for each domain. So what we found across the SF-36 among these patients was the quality of life domains with the lowest scores before surgery were energy and fatigue, role limitations due to emotional problems, and role limitations due to physical health. If we look after surgery now, we're looking at the green bars compared to the purple bars. What we can see is that for almost all domains, the scores or the average or mean scores increased after surgery. However, only one domain increased significantly based on a statistical test after surgery, and that was emotional well-being. So one thing I want to mention is that despite this improvement, quality of life in acromegaly patients still remains, or is still lower than the general Canadian population during this study period. So what this means is that even though treated patients with acromegaly report improvements in quality of life, they don't experience the same level of quality of life as their average or the general Canadian population. So if we look at the results from the Pituitary Quality of Life Questionnaire, again looking before surgery among the 52 acromegaly patients, what we found is that the scores, the domains, the quality of life domains with the lowest scores were, again, emotional health, as well as the relationship with their physician and social/family well-being. If we look after surgery, again, green bars compared to the brownish looking bars, you can see that there were improvements across almost all quality of life domains, but the only two domains that had significant improvements based on a statistical test were emotional health and the relationship with their physician. So why might this be? Well, the improvements in the relationship with their physician may be explained because after a certain period of time and multiple interactions with their doctors, patients tend to feel better about the care and the treatment that they receive. The improvements in emotional health that were found based on the results from the SF-36 and the Pituitary Quality of Life Questionnaire may be explained by the role of growth hormone. So actually in a study done in 2021 in which Dr. Cusimano was a part of, they found that first-time surgery of a pituitary tumor led to a reduction in depression level, and this was due to reduction in growth hormone levels as well as IGF-1. So in this study, they measured depression by asking patients how often over the past week they experienced symptoms of depression that included sleep or feeling lonely or appetite and things like that. And they found that this score was lower after first-time surgery, and this was because of the hormones that were reduced from surgery. So based on all of the research that I've presented so far, what do we know? Well, we know that if acromegaly is not treated, it leads to significant physical changes, and this affects quality of life and self-image. We also know that after surgery, acromegaly patients tend to report improvements in quality of life and symptoms. But we still know that acromegaly patients still report or have lower quality of life than the average Canadian, even after surgery. So some of the benefits of detecting acromegaly sooner would be earlier time to diagnosis, thereby earlier treatment, improvements in symptoms and quality of life, and all of which would lead to a reduction in the both physical and economic burden of disease. So this is what led to our BEAGLE study, which aims to sniff out the disease earlier. It aims to detect the earliest possible changes in facial features caused by acromegaly and in turn improve quality of life. So how does our BEAGLE study work? Well, essentially step one, users would take and upload images of their face and if they have photos of their hands and feet, and also provide information about their diagnosis, including medical proof of diagnosis, information about their diagnosis and symptoms and treatment, and obviously, as I mentioned, we want that quality of life data. The hope is in the future we can develop some sort of app that would be able to feed the information into a machine learning model, and this would predict the user's risk of acromegaly. If the user is at risk of acromegaly, then the app would recommend that the user seek further medical attention and or connect them with local resources and medical information about the disease. So who can participate in our study? First and foremost, we're looking for patients with acromegaly or gigantism, and this can be either a current or previous diagnosis. So essentially, if you have acromegaly or gigantism and you've since been treated, you're still eligible to participate in our study, and we would love to have you. Secondly, we're looking for first-degree blood relatives of acromegaly patients. So this can include a biological mother, father, brother, or sister. And this is because we want our model to be able to distinguish between the features of acromegaly from familial differences, since certain facial features tend to run in the family, just like, the shape and the size of the eyes, the nose and the ears, just like Drew and Gru from Despicable Me. And then we're also looking for patients with any other type of pituitary tumor. Again, a previous or current diagnosis. So this would be a tumor that's either not releasing or secreting any hormones or secreting hormones other than growth hormone. Some examples include a non-functioning pituitary adenoma, a prolactinoma, Cushing's disease, Rathke cleft cyst, craniopharyngioma, or any other pituitary tumor. And the reason we would like to include this group is because we want, again, our model to be able to distinguish between the general effects of a pituitary tumor, for example, weight loss, and the effects of a tumor causing acromegaly. For ethical reasons and just the REB's, what they've approved, all patients have to, and participants have to be a minimum of 18 years to participate in our study. So what kind of information does our BEAGLE study collect? So in the form of a questionnaire that was developed on REDCap, which stands for Research Electronic Data Capture. So it's a very secure database or platform that's being used to collect all of the patient's information. We're looking for, as I mentioned, photographic data. So any photos you have of your face, hands and feet if you have, and 3D photographs if these are available. Obviously, you would need a 3D camera in order to take 3D photographs or some sort of 3D scanning technology that you could download on your phone. I think any phone, iPhone 12 and above, has 3D scanning capability. So you could go to the App Store and download any of the 3D scanning apps available. An example is the LiDAR Scanner 3D app. We're looking for medical proof of diagnosis of your condition. We're looking for information about your diagnosis and symptoms. So when were you diagnosed? How were you diagnosed? What sorts of symptoms do you have relative to your diagnosis? We're looking for information about your treatment. For example, have you been treated? When were you treated? Do you take medication? What sorts of medication do you take? And then, as I mentioned, very importantly, we're looking for quality of life data. So I mentioned this earlier, but I'll mention it again. We're going to be collecting quality of life data using the Pituitary Quality of Life Questionnaire, which is a questionnaire that's been designed and is specific for patients with a pituitary tumor. So just know that we're using a valid and reliable questionnaire to capture this info. So in terms of photograph requirements, we're looking for a minimum of 2 facial photographs taken at 2 different time points over a 10 to 15 year period. We're looking for at least 1 recent photograph. And if you have more photographs, the more the merrier. You can upload up to 50 photographs in our questionnaire. These are just some examples of the ideal types of photographs that we're looking for. So preferably, we're looking for photos with a uniform background, passport style, unedited, that show your face and neck. You can also provide profile photos if you have those available. Preferably no glasses, no mask, no expression, as these are optimal for analysis, but we can work with all types of images. For the requirements for hands and feet, we're just looking for photos of your hands and feet if you have them available and you're willing to share, preferably on a uniform background with fingers and toes spread apart, because these again are optimal for analysis, but we can work with all types of images. What we're hearing a lot from some of our patients is they have photographs that are hard copies that they would like to include, but they don't have digital versions. So we are definitely available to help you digitize these photos through scanning them and helping you upload them to the questionnaire. So the research team, which includes myself and some of the other people that work on the team, are always available by phone or by Zoom to help patients upload their photographs at any time. So I'll share all our contact information at the end, but feel free to always contact us if you have any questions, concerns, or need any help. And I just want to mention that all of your information that you provide, whether it's your photographic information or your personal health information, will be kept strictly confidential and only accessed by authorized research personnel. As I mentioned, we're looking for medical proof of diagnosis, and these can be in the form of any of these documents. So if you have an MRI report or scan, a consultant's report, a pathology report, any sort of lab results that show your levels of growth hormone or insulin-like growth factor, a neurosurgical report, any of these will suffice. If for whatever reason you don't have access to these documents, you should contact your doctor or the hospital where the test was performed, and you can ask them to send you a copy. Some patients still, even they've done this and they still have challenges, so you won't be excluded from participating if for whatever reason you can obtain these documents or you're not willing to share these documents. It's not required. It's just a part of the questionnaire, and if you have it, it's valuable, but it's definitely not a requirement. So you're still eligible to continue on in the questionnaire and be a part of the study. So I just wanted to give a little bit of an update in terms of our participation to date. Since we launched our study, which was about less than a year ago in November of 2023, we've had some participation, but nearly not enough. We've had about 77 questionnaire entries to date. 46 of those have been completed by acromegaly patients. 29 of those have been completed by patients with another pituitary tumor, and less than 5 have been completed by relatives of acromegaly patients. So as you can see, we definitely need your help. And most importantly, only less than half of the patients who've participated have only fully completed the questionnaire. So that what this means is patients have stopped at various points in the questionnaire and they've only provided some information, but not all. So they could have started at the demographic piece and then stopped, or provided some facial photographs and stopped, or they skip a bunch of sections, or they're just not providing full information. So right now we don't have enough data to do our analysis and train our model. So this is where I come in, and that's why I'm here. So as you can tell, we need participation essentially by all groups, especially relatives of patients with acromegaly. We're really looking to get at least 1,000 participants from Canada alone, which is a lot. As I mentioned, most of the patients have only partially completed the questionnaire, which means we're missing valuable information, including photographs, medical documents, quality of life data, treatment information, symptom information, diagnosis information. So it's extremely important that we get your support. As you know, acromegaly can affect anyone, and everyone around the world looks different. So we need more data to train the model to be able to account for these differences. And so because we want our app, we want BEAGLE to be able to account for differences in genders, sexes, ethnicities, and so on. So how to participate in our study? Well, if you're interested in participating, you can visit the link or scan the QR code. As I mentioned, the research team is always available to help. I've also printed a bunch of our study posters, and Deanna has been kind enough to print a bunch of our study posters, and she's left them on the table. So please feel free to take one and or take a few and share them with everyone in your circle to help spread awareness about our study. I also want to mention that anyone who participates has the option to participate in a draw to win an Amazon gift card as a token of appreciation for participating, so that's just an incentive. So again, we need your help. As I mentioned, we've had tremendous support from our patient support groups, especially Acromegaly Canada, which is the host of this amazing event, as well as Vancouver Acromegaly Support Group. We've also had support from our acromegaly community, which is Jill's organization in the US, as well as other pituitary organizations, which give us access to over 30,000 patients. We've also had support from a lot of hospitals in Ontario, clinical sites in Ontario, which have been instrumental in advertising our study by emailing or mailing a study letter to their patients and or posting this poster in their clinic. But we need your help. We can't do it without you. We need more data. So we encourage you to share the link with as many people as possible in your circle. share the QR code, get your doctors involved, encourage your endocrinologists, your neurosurgeons to get involved and to help spread the word about our study. So I just want to finish with a little bit about the impact of your support. As I mentioned, acromegaly takes an average of 10.5 years to be diagnosed, and by then, the almost irreversible changes to health have taken their toll. We know there are 1.3 billion people living with hypertension, 463 million living with diabetes, and 18 million deaths per year from cardiovascular disease. We also know acromegaly is underdiagnosed. So what if through BEAGLE we could cure the cause of even a small percentage of these conditions? What if through BEAGLE we could provide an option to underserved populations? What if through BEAGLE we can prevent countless years of suffering and millions of dollars to our healthcare system? And what if through BEAGLE, the next time you take a headshot, it won't just be for LinkedIn, but for preventing disease as well? Thank you. I just wanted to leave up the QR code again. If you're interested in participating in our study, learning more, or need any help whatsoever with completing any aspect of the questionnaire, or have concerns about the consent form or confidentiality and privacy, we're more than happy to help. You can contact us at acromegaly-research@smh.ca, or you can telephone us at either of these phone numbers, and we would be happy to help. Again, posters are on the table there if you'd like to take one on your way out or pass them to anybody that you think may be interested. And I just want to thank you so much for listening and having me here today.
Okay, questions?
Thanks, Melissa. I spoke to Dr. Cusimano last year about this, and
Amazing.
number one, I'm so glad you have those cards, which are nice, because I have these things I put up in my office. I don't have room anymore to put things up, but take my own paintings down. For the ones that have partial completion, is someone following up with these patients? Because that's critical, right? Because, you know, there's so many things. Everyone's asking for money these days, right? Fundraising. So there needs to be some follow-up.
That's a great question. So originally when we launched our study, we didn't have this piece of follow-up because we weren't sure how things were going to go. As time went on, what we were noticing, because I, as the research coordinator, have access to the back end of the database, so I'm able to see, and I was seeing a lot of patients were stopping at various points, but we didn't have an option on the consent form to collect their email address to contact them for any sort of follow-up purposes. So we decided to submit an amendment to the REB to request that we collect this information. So now this is available on at the bottom of the consent form. There is an option. You will have to provide consent in the form of your email to be contacted by the research team for any follow-up purposes. So we can see, okay, you're stuck on this part. Do you need some additional assistance? So we definitely have incorporated that because we feel that is very important. And if we can even get all of those people that are only at the partially completed stage to complete, we would have much better numbers. So the great question. Yes, we have done that.
Love asking questions. Tell us about the piece of family members being part of this, because I do have daughters that may, but they'll want to know why.
Yes. So as I mentioned, we're looking for family members because we want the model to be able to distinguish the familial differences from the actual features of acromegaly. And so we're definitely looking for that piece. I'm not totally sure if children can participate. I'm not totally sure. I know we have biological father, mother, brother, and sister of the patient. I'm not sure about children. I will double check about that, and then I can let you know if that, I think yes, adult, it doesn't matter, it wouldn't matter, they would have to be 18, but yes, I think they're still eligible to participate in our study. So.
Good question.
Yes.
Can you tell us a little more about the machine learning piece of this research?
Yes, I can try my best. My area is not computer science, but the hope is we would feed the model and then train the model based on like the images to be able to detect the disease earlier. not my area of expertise, so I don't know too much about the actual analysis that we would be doing. We have some analysis indicated that we plan to run, but we haven't done any of that yet. So, yeah, unfortunately, I can't comment further on that.
You're working with an AI?
Yes, it'll be machine learning and artificial intelligence is that's what the analysis will entail, and then that will be what the app is based off of. It will be that algorithm that.
And have you started that work at all?
We haven't started that yet because we need, essentially, the way my understanding of machine learning and training models is you need a lot of data. So it's like usually when we submit, information to to the REB about protocol, and they ask, okay, what's your sample size? With this type of study, it's very difficult to give them like a concrete number based on an equation. It's more like the more information you can feed the model, the better. So we're looking for like at least 1,000 patients before we can run. We run some analyses. We plan to do some pilot work, like using some pilot data, run some analysis to start training the model, but we need more than 77.
I think, JD, you
patients to
should
do
do a
that.
write-up on this and post it out. I think you should do a write-up on this and post it out, because we do post out on the closed Facebook sites, right? But JD's got a long arm connections around the world.
Well, just really quickly, there's a group in Barcelona, Spain, that is working on a machine learning program for acromegaly. There's a meeting later this month on where they are, but they're working with an AI, trying to feed tens of thousands of photographs to this machine learning program to see if it can recognize the difference between an unusual face and a normal face. And it takes both sides. So eventually we're going to need the help, or they're going to need the help, I should say, of everybody that wants to send a photograph in to get analyzed. It's a humongous project.
Yeah.
But it's probably going to be game-changing if indeed the machine can learn to figure out what the differences are early on.
Yes.
So
Yeah, so that's what we're hoping for, and
And
we're definitely open to collaboration. I know Dr. Cusimano is, so.
And I've talked to Dr. Cusimano. I've known him for a couple
Yes.
of years. So I'll give you some information.
Sure,
so you can
perfect. I'd
speak
love
to him.
that.
So just to clarify, so then would the ultimate goal be if the BEAGLE app is successful at identifying acromegaly cases, or the Barcelona group, that then it's just applied to people's photographs on their passport or their driver's license?
I think the hope would be that we would
because
develop.
you'd have to consent to that, I guess.
Yes, I think the hope would be we would develop an app and it would be universally accessible by anyone, so they could download it and add it to their phone, and then they would take a photo of themselves, and then the model would kind of predict, okay, based on these facial
Right.
features that we're recognizing, this would be your risk of this particular.
But it'd still have to be somebody say, oh, I wonder if I have this disease. I'm
Yes,
gonna
they would
submit
obviously
it.
have
Whereas,
to.
like, really, if you want to get early case detection, it's almost like you want to screen the people who have no idea.
Yeah,
But-
or
The machine has to recognize that there's a difference. And that's what
Yeah.
machine learning makes it so interesting.
Yeah, but I also get it that you can't, I'm sure there's a big hoop for it just to be applied to everyone's driver's license. Like, people can't,
yes.
would have,
I've discussed with Dr. Cusimano for like sleep specialists or rheumatologists that might suspect
Yes.
the disease.
They would have access to the app.
Yeah, have access to the app, and they can scan their patients
Mhm.
and say,
and I guess at least you'd learn more using the app and how
Yes,
it works.
like we're hoping.
But then, oh, Deanna wants to talk. But then, but then I was just going to say that you could argue if somebody is clinically suspicious, they should just do an IGF-1. The problem is we're thinking about, we want to find the cases where people have no idea. They just
Right.
think they're looking a little different. They're older. They're not seeing doctors regularly. Their doctor has no idea.
Yes.
Somehow the app has to get to,
Right.
yeah.
Yeah, you want to do this in year 1, not year 10.
Mm-hmm. Yes. Yes.
Oh, thank you. So you need controls, right? That's critical, and I'm sure that's going to be developed, because without controls,
That's why we have the family members.
Yes,
Those are the
yes.
healthy controls in
Yeah,
this
yeah.
case, and then also the the other pituitary group would be
So-
our third control. Oh,
so the important thing here is that we have to distinguish this from a this is not a diagnostic test, because a diagnostic test is someone new. The probability is so high. So if it's a screening test, you want to rule out disease. So I think this would be really applicable to the dentist, where you don't want to
Yes.
start throwing off IGF-1 levels, because the problem is you're going to get that 210, where the upper limit of is 200. Then you're going to be doing OGTTs. It's going to drive the system and the patient crazy, right? So you want it in populations that are at higher risk. Dentists, for example, sleep specialists, orthopedic surgeons, for example, right? They see a hip, they go, okay, maybe I should tell this patient, can you do this app thing, right?
Yes.
That way we'll avoid false positives, because you're going to get a lot of false positives.
Right.
That's going to happen. We're going to be doing more IGF-1 levels as a result of this. There's no doubt, right? Because for a screening test, it's the nature of screening tests, unlike a diagnostic test. So I'm sure that'll be looked into, and I'm sure the REB, when you apply this, REB grilled you on this kind of
Yes.
stuff. And
Oh, yeah. It took like almost 4 years to get this just REB approved and the consent language and everything to be properly, applicable to, because it's an international study. It includes patients in the UK, and they have the GDPR now. So there's all these different rules and regulations that need to be followed to ensure patient privacy. So it's been a long time coming, but we're happy to see it up and running, and we're excited to have more participation and to get more awareness about it and get it out there. So.
One more question?
Thanks. I just wanted to ask really quickly, what is your timeline for the study? Like, are you planning to keep this open for another
Yes,
10
good
years or 20 years? Because
I think, yeah, I think
1,000 patients is a lot,
Yes,
but
yes.
it's good to know that it's
I think we have it
international.
as a 5-year study right now, so we plan to keep it open for quite a while, but we'll obviously see how enrollment numbers are, and then, like I mentioned, we do want to do some analyses with some pilot data. Like, we're not going to wait until the very end to get all the data. We'll use some of the, because even though we only have 77 patients that have participated, for each component, each component of the questionnaire, there's multiple options to upload multiple things. So, for example, one patient could upload 50 photographs. So we're using the images and the number of photographs to train the model. So it's not really based on the number of patients, but more based on the number of images and documents that we're able to feed the model. So I think we'll be able to do something relatively soon with what we have. We want to increase those numbers, of course. But yeah, the study will be open for quite a while, so it gives people that window to still participate if they're interested.
And more Amazon gift cards.
Yeah. More Amazon gift cards, yes.
Would it only be available through a doctor's office or something like that? I was just kind of thinking one of the other pituitary Facebook sites. There's a lot of people in there who I think are just doing research. They know they have hormone difficulties. They know they have certain things wrong, but don't have an answer. I didn't know if something like this is an easy way for them to feed their picture in and kind of give them an answer and a direction to go in their research, trying to figure out what's wrong with them.
Sorry, so I didn't get the question there, sorry.
So the general public, I guess, would they be able to access this?
You would need to have a pituitary tumor or acromegaly, or you'd be related to someone with acromegaly. But if you put it out to the general public, that's fine. And if someone who has either of those things, they can definitely participate. But
Yeah, they got to be pre-diagnosed already.
yeah, they would have to have like a current diagnosis. If they've been treated, they're still eligible. But they would have to provide, the documentation to support that.
But when the app is completed, it would be available.
Oh, yes, if you're talking about like
I don't think I made that. Yeah.
Oh, okay, you're talking about the app stage. Yes. Oh, I thought you meant like the questionnaire being available to the general public. Yes, it would be universally available so that anybody, and then we're hoping not only patients, but like healthcare providers, professionals, dentists, other professions that have a bit of a lack of awareness about the condition to date would be able to use these tools to help with earlier diagnosis for their patients. So yes, it would be available to anybody, general public, not just these groups.
So I have an example of something that would be helpful with this.
Sure.
My younger sister has a son he's 21. He's taller than me, bigger than me, and she was worried that he had acromegaly. And she went to her doctor to say, is it possible that my son has acromegaly? And the doctor in Edmonton said, oh, that's so rare, it's impossible that he has it. I don't know. He wouldn't test him because it was so rare. And then my sister said, well, my brother has it, and he didn't believe it. So
Yeah, this is part of the issue. I feel that it's deemed rare because there are so many patients that go underdiagnosed, so it doesn't really add to those numbers. So I think that's why there's like a misconception about how rare it really is. Definitely is rare if you think about some other conditions, but I think more people have it than know they have it. And so this is part of the problem. This is what we're trying, this is what I think speaks to what Dr. Johnson was saying about, you know, getting it to way ahead of time and getting it to people who don't even think they may have it. And let's see if they do, so we can kind of prevent all these years of suffering and the chronic diseases that come along. And so.
He didn't have it, by the way.
He didn't have it.
He
Okay.
didn't have it. He's just a big,
just a big
boy.
guy.
Yeah.
Okay.
Oh, I was just saying there definitely are like a small group of acromegaly patients that have a genetic syndrome or predisposition, not just a predisposition, and then their kids would have a 50% chance of having it. So identifying those people with the genetics is important, and the genetics has gotten a bit better. I was just saying, Deanna, that could be a good subject of a conference meeting at some point.
Yeah.
And then I have one quick question, because I think it'll be relevant for recruitment. I don't know if anybody here in the room has done the questionnaire,
Yeah,
or if
good
Melissa could tell us approximately how long does it take to do it? Because I feel like my patients will ask me that, and I get it that it might depend, well, how long is it going to take you to find the photos and
That's right.
upload them? But with that
Yes.
aside, just the questionnaires.
I think it takes about, it's a range. So I would say about 20 to 60 minutes, and it really depends on how prepared and organized you are, especially when it comes to the photographs. Because for each photo, we ask, okay, relative to your diagnosis, when was this, like we ask for the date of the photo, and then relative to your diagnosis, when the photo was taken. So it can be before treatment, after treatment, before a diagnosis, things like that. So there are a couple questions that they have to answer for each photograph, and then if they're having challenges navigating the platform, or we were looking for certain formats of the photos. Most people's photos, I would say, are in the correct formats that they need to be, but sometimes people, like I said, they have old photos that are hard copies that in a photo album from 20 years ago, and they're like, look at how I looked, and I would like to include this, but I have no way of getting it into the questionnaire. And then they would need some assistance with the scanning part and the uploading, and it depends how technologically and computer savvy you are too, because it's completely electronic, right? It's not a hard copy questionnaire. So we alleviated like the need for research assistants to sit with each patient and go through it. So we have it that the patients go in on their own and they go through it, but then there is some challenges they may face, and this kind of impedes their ability to finish the questionnaire, or they get frustrated, or they get fatigued, and they're like, I don't want to do this. All right, I think I provided enough information, and they just force quit, right? There are options though to save and return later at any point. So if you find you're not organized, or you didn't budget accordingly, and you find like, oh, I didn't realize I have to provide this much information, I'd like more time, but I'd like to continue, they have the option to save and return later. A prompt will come up, you enter your email address, it'll send you the link, so that when you are ready, you can click that link and then continue where you left off. If you don't do that and you force quit it, it'll just stop wherever you stop, and that's all you get. If you want to start again, like if you would like to continue at another point, you would have to start the questionnaire again. So that's just one of the limitations of REDCap, and that's the way that it works. So that's why we ask that you be organized, set the time aside if you are serious about doing it, and if for whatever reason you have somewhere to go and you change your mind, or you'd like to continue another point, just save and return later. Come back, finish at another point. You can take 5 days a week to do it, but if you can just complete everything, that would be more valuable than just completing the first section, let's say.
So what you need to do is do a pre-checklist.
That's right.
Prior to them getting started, you just do a pre-checklist
Just like,
above.
do you have all of these
This
things
is what
done?
you need to have ready when you start downloading your information, and it'll speed it up for the patient, right?
That's a good idea.
Okay.
Thanks,
Thank
Deanna.
you so much for coming and presenting
No
for us. This
problem.
is wonderful, because I
Thanks for
really
having
want to
us.
start spreading this out, because I
Yes.
really think it's a really good idea, this project. So thank you for
Thank you
coming.
so much, Deanna.